Chaeyoon and I and some other people, David Campbell at University of Notre Dame, about 18 months ago, published a book about the changing role of religion in America. And this is a book about how religion exists in our lives and how that's changed over the last 50 years. But one part of that, we got intrigued with exploring the relationship between religion or religiosity and what's technically called subjective well-being. There are different kinds of well-being, of course. There's well-being you could measure in objective ways. Do you have a job or not? Do you have good meals or not? Are you suffering from heart disease or not? And then there's a separate body of research on subjective well-being, how you feel about life, how you feel about are you happy or you think you're living a satisfying life, and so on. And what we discovered is that there's a lot of work that's been done over the last 30 or 40 years on well-being, on subjective well-being. There are different ways of measuring the question of how people feel. You can ask people to put themselves on a ladder of 10 points. Where the top of the ladder, I feel just absolutely fantastic, is 10, and I'm about to commit suicide is 0 on this ladder, and you can say where you are on that ladder. There's questions that ask how satisfied are you with your life. Questions about emotions. How about yesterday? Did you smile a lot or did you not smile a lot? Did you feel sad yesterday or not? There's questions, a really interesting set of studies done by Alan Kruger and Danny Kahneman. Danny Kahneman is a Nobel Prize winning psychologist, economic psychologist, and Alan Kruger is now the chairman of the Council of Economic Advisors. They've done some interesting studies in which they give people little buzzers to carry around with them in their pocket. And when the buzzer goes off randomly, you input what you're doing at that moment and how you're feeling about life. And so this is called experience sampling, and you can therefore just check and see, how happy are people when they're brushing their teeth, or how happy are people when they're playing with their grandchildren, or how happy are people when they're at church. All of these different ways of measuring, and there are a lot of subtleties in the different ways of measuring subjective well-being and linking it to objective measures of well-being. But one of the things that they almost always find is that religious people are happier or more satisfied with their lives than other people. And that's been found, for example, when the buzzer goes off and you're at church, the same person is happier when the buzzer goes off when they're in church than when they're not in church. The same, and across a range of different countries in the world, and a range of different ways of measuring religion, and a range of different ways of measuring well-being and health even. There's been a lot of research, not all uniform, of course, but much of it over the last 20 years or so has shown that religious people are basically more satisfied with their life, and by some measures, less likely to be depressed, and in other ways, healthier. But why? First of all, is that causal? Or could it be that people who are, feeling good about life are more likely to go to church, to thank God or to celebrate with other people? So maybe the causation runs from the happiness to the church rather than from the church to the happiness. There are many reasons why you think this might not be causal. And then there's also the question of, well, what's the mechanism? Why would people who are more religious, or people when they're in a religious setting, be happier than people who are not religious, or the same people when they're not in a religious setting? So there are a lot of questions here, and the people who are going to be speaking now are going to be giving you bits and pieces that are trying to, first of all, show there is a relationship between religion and life satisfaction or happiness or other measures of well-being, and then try to unpack, is that causal, or is it just a spurious relationship, and if it is causal, what's the mechanism, how does it work?
Let me show you what we're dealing with here just very briefly. One thing that you'll run across as we are all talking is, how do you define religiosity? There are a number of ways of doing it. The two questions that we actually asked 3 questions in our Gallup Healthways Wellbeing Tracking, which is 1,000 randomly selected individuals are interviewed every night of the year by Gallup, except for holidays and a couple of other exceptions, which yields 350,000 interviews per year that we were able to analyze. And every single one of those respondents is asked, is religion important to you in your daily life? And every one of those respondents is asked, how often do you attend religious services? Weekly, almost every week, monthly, seldom or never. In addition, we ask, what is your religion? And so we're able to identify at least major types of religions. We can't get into Protestant denominations because there are thousands of them. Taking this together, many ways of looking at it, here's what we've done at Gallup. We've created our top segment of the very religious. About 40% of the population are those who respond affirmatively that religion's important in their life, and they attend church on a weekly or almost every weekly basis. Our bottom group of the non-religious are those who say basically no to the above. Not religious, seldom or never attend church, and then the moderately religious is kind of the dump group of everybody else that's in the middle. That's fascinating because we'll notice some very interesting differences between this bottom group and the moderately religious group that we talk about. Let me show you the sample size. One of the great beauties of what we've been able to do here at Gallup with our Healthways Gallup Wellbeing tracking is to have enormous sample sizes. Trust me, the normal sample is 1,000 people to represent America, a normal random sample that you would see. Jews are 2% of the U.S. population, Mormons about 2%. So in a normal sample, you'd have 20 people. So you can look at the difficulty you would have at trying to analyze these groups and break them into segments. We now, in the data that we're looking at for the most part, compiled from 2010 and 2011, have well over 600,000 completed interviews, so we're able to break it down into these enormous Census Bureau type samples, which really gives us, the ability to really look at stability in the estimates and statistical significance of differences, and also to be able to look at the types of subgroups that we would not be able to look at otherwise. To give you an example of this, and you don't need to stare at this carefully, but this is the number of interviews that we conducted over the last 2 years, and I'll be talking about across religious groups. And we were speaking earlier, look at the group of people who say, I have no religious identity. That's a fast-growing group. In the 1950s, Gallup polls found in some Gallup polls, 0 people did not give an identity. In other words, every single respondent we talked to had an identity. We call it a dog tag religion. When you're in the Army, they put, at least they used to, put a religion on the dog tag. Now we have up to 15% of Americans who will say, I don't have a religious identity, which doesn't necessarily mean they're not religious, although it tends that way. It simply means they don't have a formal identity. But because of the large sample sizes, we still ended up with 1,982 people who were both no religious identity but classified as very religious. And that's a very small percent of the population, but because of our huge sample sizes, we're able to isolate those people, which is one of the fantastic things about the data. Notice Jews in general in America are not religious, the least religious group that we look at. So it's hard to come up with highly religious Jewish Americans, but we were able to isolate 2,390 of them over the last 2 years because of the large sample size. It's something that would just be very difficult ordinarily. Now, with that said, here's the core data. Our dependent variable we're looking at here is what Jim Harter spends his life isolating, and that's our Gallup Wellbeing Index. And as I'll show you in a moment, the Gallup Wellbeing Index is actually a compilation of scores from where respondents are asked questions about 6 different domains of their life. And once you answer questions in the 6 different domains of your life, that's added together and the formula produces a well-being index score. And that's our dependent variable that I'm talking about in this very fundamental chart. There's not a lot of variance in this well-being index. So you say, well, these aren't large differences, but actually I think it's correct over our highest and lowest state of the union. There's only about a 10-point difference between the highest and lowest state in well-being. So this is a very stable measure that doesn't vary a lot across subgroup populations. So what we're looking at here is a highly statistically significant difference where our very religious Americans, 69.2, moderately actually lower than non-religious, 63.7, and non-religious, 65.3, based on data from 2010 and 2011. Religion, as you well know, is highly correlated with a number of demographic and regional variables in the population. Vermont's the least religious state in the Union. Generally, Mississippi is the most religious. Old people are more religious than young people. Other people will be talking about it. Women more religious than men, and so on and so forth. But we control for these factors. So the analysis we're looking at here in a multivariate analysis controls for age, gender, race, and ethnicity. African Americans, the most religious ethnic group in America, controls for region and state of the country and socioeconomic status, marital status. People who live in a domestic partnership are the least religious of any marital group. Those who are married are the most. And childbearing status, people with children are more religious than people not at the same age. So we're controlling for all those factors statistically. And once we do that, we find kind of the fundamental chart. Again, highly statistically significant. The data show, based on 600,000 interviews, Americans who are very religious have higher well-being than those who are non-religious and those who are moderately religious. The difference between the last two we'll come back to. Look carefully at this. These are the 6 domains, and you don't have to spend a lot of time studying it. In fact, this is on our website today, Gallup.com. If you don't have time to take it down here, or the article that came with your packet, feel free to look it up online. But generally speaking, with one exception across our 6 indices, those who are very religious have a higher well-being than those who are not. The 6 domains are life evaluation, where we ask people to evaluate their lives, emotional health, I'll show you the components of that in a moment. Did you worry yesterday? Did you have stress yesterday? Physical health, which is a compilation. Have you been diagnosed with diabetes, with cancer, a variety of other conditions, back pain? Healthy behaviors index, which shows the largest relationship, and I'll get back to that in a moment. Eating vegetables is one component of that. Work environment index, are you satisfied with your job? Does your manager treat you well as an employee, which is a real core that we focus at Gallup on? And basic access, do you have access to what you need, like a doctor in your area? Can you get vegetables where you live, and so forth? The one exception to the differences we find is on physical health, and I'm going to come back to that. You'll notice that those who are non-religious are no more likely to say, those on the physical health index, there's not a difference between those who are very religious and non-religious. On all the other dimensions, there is a significant relationship. Let me burrow down into this. Smoking, I think Angus has found as well worldwide, is probably the biggest discriminator we find on health. So the American tobacco industry, therefore, has a strong interest in making sure that Americans are not religious. You see what I mean? Because obviously, if you look at the data, the more religious you are, the much less likely you are to smoke. But it's not just smoking. Notice the vegetables and fruits, controlling for all of the variables. Those who are very religious are more likely to say they've eaten 5 servings of fruits and vegetables, and also exercising. Those who are religious are at least slightly more likely, statistically significantly more likely to exercise than those who are not. Controlling for all of the variables, healthy behaviors are higher among those who are religious than those who are not. One component of our emotional health and others, have you been diagnosed by, I think the question is fairly official, has somebody, medical authority, told you that you have depression? So it's not just you feel depressed, but this is our equivalent of a self-reported clinical diagnosis of depression, and you'll notice a fairly significant difference there between those who are very religious, moderately, and non-religious, and self-report of diagnosis with depression. These are questions which actually Danny Kahneman, that Bob mentioned, Nobel Prize-winning economist who works with us here at Gallup on this, helped us develop questions. Instead of just saying, do you worry a lot? The way we ask in our surveys is to say, did you experience worry yesterday? Did you experience stress yesterday? Did you experience anger? The idea being that Americans, or any respondent, is more accurate when they self-reflect. Self-perception theory, as Darrell Bem called it, University of Michigan, his doctoral dissertation once. We're more accurate when we just reflect than we are to say in general, you worry. So that's why we ask questions in this fashion. Same way in a job interview, don't say, are you a hard worker? You say, do people who know you, would they call you a hard worker? And often you'll get a more honest response than if you say, are you a hard worker? But nevertheless, you see again the statistically significant differences. People who are religious are less likely to report all of these negative emotions. We look briefly at well-being by religion. It's a paradox. Jews are the least religious and have the highest well-being, even when controlling for these other factors, something we can talk about later. But just for your background purposes, this is well-being. Those who are no religion are the lowest on well-being of any group we look at. Across all religions, with the exception of the bottom row, those who are very religious have higher well-being than those who are not. Let me pause for a moment. As I showed you earlier, there are not that many Jews who are highly religious, but we're able to get them in our sample, and they would be more Orthodox Jews. But as you look, those Jews who are very religious have higher well-being, controlling for everything else, than the vast bulk of Jews who are not religious. Mormons are highly religious, but the highest of the high religious Mormons have higher well-being than the Mormons who are not, and so on down the line, except for that bottom line that we can come back for. There doesn't seem to be a very small number of people with no religious identity who are very religious, don't differ significantly in terms of well-being. And finally, this is the same chart I showed you before, but Jim Harter was very interested in this chart. This is just the percent religious across the groups, and again, it shows you what groups in America are religious and what aren't, and it reflects the sample sizes that we saw earlier. So the bottom line, out of a lot of data that we have looked at, our dependent variable of well-being as we measure it, based on the 6 domains that you looked at in a large series of questions that we developed over the years and have been asking since 2008, those who over here tell us they are very religious, as we classify them, have higher well-being on these domains, controlling for everything statistically that we can think of to control for. And as a bottom line then, we're simply giving this as one example of what Bob said a moment ago. There is a relationship between being religious and having higher well-being in the United States today.
Focusing on 3 questions, does religion make people happier? I think a short answer to that question is yes. I think we have a fair amount of evidence that religious people are happier. And also there's an increasing amount of evidence that people who have become more religious over time also tend to become happier and more satisfied with their life. So the relationship doesn't seem to be purely correlation, although we need more research to be sure. So if religion does make people happier, what is it in religion that makes people happy? We are going to make an argument that it actually has little to do with your belief system, theology, how often you pray. It mostly has to do with religion as a social institution. The fact that you go to church and build social relationships and social networks in church. So in other words, church friends seems to be the key to this relationship between religion and subjective well-being. So if it's church friends that make you happy, then the natural question is whether there's anything special about church friends, or whether you can get a similar benefit from non-church friends, non-religious secular friends. So we are going to talk a little bit about that as well. So starting with the first question, again, we are looking at the relationship between church attendance. No matter which data you are looking at in the United States, you're going to basically see that religious people tend to have a higher level of happiness, higher level of life satisfaction. But religiosity could be measured in many different ways, right? You know, how strong you believe in God, how often you pray, and so on. But what you're going to find is that the strongest and most consistent predictor of happiness and life satisfaction, and it's in the United States, is how often actually you go to church. Not how often you pray, not how strong you believe in God, but how often actually you go to church. So we have church attendance on this side, life satisfaction on that side. What you're looking at here is that people who go to church more often are actually more satisfied with their life. And it doesn't matter which religion you belong, right? Protestant, Catholic, Jewish, Mormon, Muslim, it doesn't really matter. As long as you go to religious service more often, you're more likely to be happy. Even people who say that they have no religion, the fastest growing category in the United States, people who go to church more often, they are actually more satisfied with their life. Of course, correlation is no causation. You are controlling for age, education, income, and so on. But still, as Bob said, it's possible that maybe happy people just more likely to go to church. So, and it's almost impossible to prove causality for these kind of things unless you have a twin and flip a coin and raise one kid that's religious and one kid that's secular and see what happens then. But even in that case, it's going to be almost impossible to isolate the causal relationship between. But what we did is that we interviewed the same group of people 3 times over 5 years, from 2006 and 2011. And people who have become more religious in these periods, somehow they begin to go to church more often. They actually got happier and more satisfied with their life in this period as well. Again, we need to do a lot more research to be sure about this. I think there is growing evidence that the relationship is not purely correlational. But maybe people who go to church, maybe religious people just like to say that they are happy. Maybe it's just their way of talking. But if you look at things like depression, you basically see the same pattern. People go to church more often, less likely to be told by their doctor that they have depression. Or how they feel day to day, right? So people who go to church every week are more likely to feel happiness, enjoyment. They're more likely to laugh. They're more likely to say that they learned or did something interesting that day. And what's more interesting is that most of Americans think weekend is awesome, right? Most of people think that they feel happier, they feel more enjoyment. But between Saturday and Sunday, most of Americans prefer Saturday. So do I. But people who go to church every week actually think Sunday is actually better than Saturday. They feel actually happier on Sunday than they do on Saturday. And they are the only people like that in the United States. They actually feel, they are less likely to have headache compared to non-churchgoers, especially on Sunday. Again, they're the only people who have fewer headache on Sunday than any other day of the week. So, weekend, this is awesome. For most of Americans like me, Saturday is better. But these people who go to church every week, about 30-40% of Americans, Sunday is the best day of the week. But so there is a pretty good evidence that there is a very strong relationship between church going and a subjective well-being. But how strong relationship we are really talking about? Are we just talking about small difference that's just statistically significant, or are we talking about something that really deserves our attention? So in the Faith Matters survey we collected in 2006, the difference in life satisfaction between people who go to church every week and people who never go to church is similar to the difference between people who say that they have very good health and people who say that they have good health. And self-reported health is the strongest predictor of life satisfaction, period. So this is pretty substantial. Or if you like money, actually the difference between church-going and non-church-going life satisfaction is similar to the difference between people who make $10,000 a year to people who make $100,000 a year. So about $90,000 difference. If you look at the Gallup data or general other data that measures subjective well-being differently, it's a little bit different. It's smaller, but about $50,000, $60,000 difference in terms of household income. That's how big the difference between churchgoers and non-churchgoers is in terms of life satisfaction. So if you want to improve your life satisfaction this year, you can either make another $50,000 to $90,000, or you can begin to hit gym more often, improve your health, or I guess you can go to church more often. I guess that's the... So churchgoers are happier, but why? What in church makes people happier? So in Faith Matters data again, what you find is that people who go to church more often are happier mostly because they have more close friends in church. Actually, the number of close friends you have in church explains about 80 to 85% of the correlation between church attendance and life satisfaction. In fact, people who go to church on a regular basis but say that they have no close friends in church, and there's quite a few people like that in our data. About 15% of Americans who say that they go to church almost weekly or more often say that they have no close friends at all in their church. And they're actually less happy than people who never go to church at all. So it's not really about going to church and sitting alone, and listening sermon and so on. It's about having these social networks and friendship networks in church that seems to explain the relationship between religion and life satisfaction. I think at this point, it's important to emphasize what aspects of religion actually do not predict happiness and life satisfaction, because there's a fair amount of confusion in the literature about this. Once you control for church attendance, how often you pray, how often you actually have religious service at home, how strongly you believe in God, whether you are a born-again Christian or not, none of these things, almost anything else about religion really doesn't predict life satisfaction as long as you control for church attendance. Even things like whether you experience God's presence in daily life. People who say that they feel God's presence every day are not any happier than people who say that they never feel God's presence as long as they go to church about the same time. So it's really about church attendance and building your social networks there, not about your belief system, theology, what kind of God you believe in, and so on. So finally, if church friend is the key to this relationship, is there anything special about church friend, or is it more about having a group of close friends and meet them on a regular basis as a group and maybe doing something together, kind of activities that are meaningful to you as a group? So in 2011 Faith Matters survey, we asked people whether they have any non-religious group they are participating in, like book club, bowling league, professional organization, and so on, right? And then we asked whether how many close friends they have in those organizations. We also asked how many close friends they have at work, because workplace is the most common source of friendship, and those are the friends you get to see every single day, right? So we are wondering whether we have a similar benefit by having more friends at work or more friends in those organizations. So what we found is this. So in general, having more friends, having more close friends is good. Even though you have no church friend at all, that's the blue line over there. People who say that they have more close friends report higher level of life satisfaction. But even among the people who say that they have same number of close friends in general, no matter where they come from, people who say that they have more close friends in church actually are much more satisfied with their life. So it's not just explained by general number of friends. It's more about having friends in church that seems to be really the key to this relationship. How about your friends at the book club and so on? They do a little bit, that's that green line. They improve your life satisfaction a little bit, but not as much as church friends do. Workplace friends, unfortunately, they don't really do. So maybe you have to be a little bit nicer to our coworkers from tomorrow. So there seems to be actually something special. It takes some pain for me to say this because I never go to church and I don't have many friends at all. So. But there seems to be something about church friends, and that's the question we are still trying to figure out. That's the question we still don't know. What is it about church friends? Is it that they do something together? Is it that it's based on faith? We really don't know the answer to that question, and we are still trying to figure that out. So I guess I'll stop there. Bob, do you have anything else to hear?
Supercharged friends. But we have no idea why church. What is the supercharging agent? I wouldn't say we have no idea. We have some hypotheses, but
I'm going to talk about the world. The Gallup World Poll, which has covered over 160 countries now, for the first time allows measurement of religiosity throughout the world. The measure I'm going to look at is the simple one, which is a yes-no question, which is religion important in your life? The question is also there about, do you attend the place of worship in the last 7 days? That's a little less useful across the world, simply because not all of the world's religions encourage people to worship on a regular basis. So the religiosity question, is religion important in your life, works everywhere. And in fact, I've redone most of the analysis using church attendance, and it doesn't make a lot of difference, but at least for what I'm going to look at. So this is a question that's independent of particular faiths and their practices. Of course, sometimes there's a criticism that compared with many surveys that focus on all sorts of aspects of people's religion behavior, these are very shallow questions. On the other hand, they make up in breadth for what they lack in depth, because we can look across the whole world. And that's never really been possible before. And it's just a great achievement of Gallup and the Gallup data that actually allows us to look across all of these countries. It's really quite a remarkable thing. So here's a picture. I like to draw these pictures. So let me explain a little bit what they are. The horizontal axis is average religiosity. So it's the fraction of the population that says religion is important in my life. And it goes from 0.2 at the very bottom up to 1, essentially, at the very top. The vertical axis shows the average life evaluation on the Cantor ladder scale. So this is, how is your life going? Where 0 is the worst possible life for you, 10 is the best possible life for you, and that's the average over the country. As many of you will know, the winners as countries, these are not people, these are averages over countries. And what I'm going to say depends very much on these. I'm not claiming this is true of people. This is true for the average of the country. Denmark always wins. Oh, let me say one other thing. The size of the circles is to do with population. So the diameters of the circles are proportional to the population of the country. So you can see the two big circles are India over here and China over here, which could not be much further apart in terms of religiosity. A huge difference between India and China. The winners in the well-being stakes at the top left, the highest ones on the graph at all, are always the Scandinavian countries. They do incredibly well. So you have Denmark, Norway, Finland, Sweden up there. They're very unreligious. The really religious places tend to be over here. There's a lot of variation over here. A lot of these countries are African countries. They're countries where basically everybody, or you're way up in the high 90s of people who say religion is important in their lives. In those countries, there aren't very many respondents who say that religion is not important to them. These data are pulled over from 2006 to 2011. Not all countries are covered in every year, but I've just pulled them, all the data I have for each country. Now, there's several groups here that, first of all, the correlation is 0.54. If you just take each country as a point, if you weight by population, it's minus 0.08. And that's, of course, because of China, which makes a huge difference when you weight the population. So there's basically this huge negative correlation across here. I've flipped those correlations for some reason. So the countries up here that are very non-religious have much higher well-being than the countries down here, which are very religious, okay? That's sort of the opposite of what we just heard at the personal level. So I'm gonna come to the personal level in a minute. Now, of course, what you're looking at here is basically to do with income. There's no control here for income at all. These countries down here are really very poor countries, especially the ones down here. The ones up here, the ones up here are very rich countries in Europe, the Scandinavian countries, and they tend to be very non-religious. So, yeah. Yep. Well, I don't know the answer to that, and I'm not sure anyone does, but the Scandinavian countries always win these well-being competitions. It's certainly not to do with their religiosity, since they're very unreligious. So we also know there's a very strong relationship between GDP per capita, between country income, and the average ladder score for these countries. So I can take that out, and you'll see what that pretty much explains all of this scatter, and you'll see that in a minute. I did want also, there's some interesting groups of countries up here. The Scandinavian ones I've talked about already. They're very non-religious, very high self-reported well-being. You've got the USA, which is a very rich country, is right up here, and is very religious relative to other rich countries in Europe who are much further over to the left. The USA, Italy, Mexico, Ireland are countries that have high religiosity, pretty high well-being too, but they're different from the other Western European countries who tend to be, have high well-being, high income, but relatively low religiosity. There's a lot of countries over here that are quite unreligious, and what I think of as the East Asian effect. There's China, Hong Kong, Vietnam, Japan, Korea, over a wide range of incomes. So even those countries are not particularly well off, they report very little attachment to religion through this question. The other place that has very low religiosity and very low well-being is the former Soviet Union countries or Eastern European countries. They're the perpetual losers in the well-being stakes. And that may be a temporary phenomenon. One might hope that might change over time. And it might also be that religiosity, which was for many years suppressed in those countries, may come back later. All right, let me show you what happens then if I control for income. So if I allow for income and then take it out, you basically get this. And there's essentially nothing there across countries. Now, that doesn't mean, this is saying that religiosity corrected for GDP is basically unrelated to well-being corrected for GDP across countries. The coefficient on that in the regression is essentially 0. is not statistically significant. So, no, population weighted, you can't do these population weighted, because if you population weight, you might as well throw away all your data except India and China. And so, you really have to think of each society as a unit here and look at how its relationship. So the statement is just across countries, not population weighted. And once you correct for GDP, there's no effect in the data. Now, that doesn't mean that the religion might still be helping people. It's just that once you allow for income, it means just what it says, no more, no less. So it's just a summary. I think I've told you all of these things. There's a strong negative correlation that's removed by allowing for income. Poorer places are much more religious than richer places, which is consistent with sort of secularization stories, that as you get richer, you don't need religion so much. Conditional on GDP, it's not true that well-being is higher in more religious countries. And as we shall see, and in fact we've already seen from the previous presentation, that's not consistent with what happens within countries. So this to me is one of the most interesting things in this area. There's a sort of paradox here, which is that people who are more religious tend to be, have higher well-being than people who are less religious. But countries that are more religious tend to have worse outcomes than countries that are less religious. That's true across the United States too, that people are more religious do better, but across states, they tend to do worse on a lot of outcomes. I've talked about the interesting groups of countries, so let me go on. We've talked a little about these other emotions. I just wanted to show you these briefly. These are the comparable pictures for 3 positive emotions. This is the fraction of people who were happy yesterday, experienced a lot of happiness yesterday, the fraction of people who smiled a lot yesterday, and the fraction of people who enjoyed themselves a lot yesterday. And these are the correlations with religiosity having allowed for GDP. So there's really very little here. There's a slight positive correlation for happiness and smiling, and a very, very slight negative correlation for happiness, for enjoyment. But there's very little there. If you look at negative emotions, the picture is not quite so good. And especially for stress, anger, and pain, once you control for income, the more religious people feel, more religious countries feel more of all of those things across countries. So once again, there's this contradiction with the individual data and the country level data. Now, this is something that I think is quite interesting. So what I've done is I've gone to each of these countries and I've calculated the difference in well-being scores for religious people and non-religious people. I haven't controlled for anything else, but I've done it for each country separately. So it's just a simple question, no controls. In country X, in Bolivia or wherever, our religious people have higher well-being than non-religious people. And in most of the world, the answer to that question is yes. This histogram plots the difference on this scale from 0 to 10 of the average well-being of religious versus non-religious people. And you can see that for 70 countries, you get the opposite from what we've been hearing, that within the countries, more religious people have less well-being than less religious people. And in 87 countries with 3.8 billion people as opposed to 2.7 billion people in the other countries, you get this positive effect of religiosity. The biggest negatives are Portugal. These are in the order of the negatives. So right out in the tail here is Portugal, where there's a huge loss of well-being associated with religion. Yemen, Iraq, Cuba, Slovenia, Nicaragua, Spain, Ethiopia, Ecuador, Colombia, and Turkey. If there's anything obviously in common in these countries, I don't know. It's not immediately obvious to me. The biggest positives are Djibouti, Jamaica, Gabon, Sudan, Myanmar, Nigeria, Bangladesh, Malawi. Both India and China are over on the right-hand side here, or at least China is. It's possible that India is the other way. They're close to the middle anyway. So it's not universally true, unless you control for anything else, at least, that religious people within countries are better off. What about women and men? In most countries, women are more religious than men. There are only 17 exceptions and 141 on the other side. Those are the 17 exceptions. Those are mostly very religious countries. So There's almost everybody's religious anyway, so the differences are not very large. That's not true in Israel, where religiosity is not so high, and yet there's still this perverse difference that women are less religious than men in Israel. If you look at old versus young, I compared people 50 plus and 15 to 49, and once again, the older people are more religious than the younger people, and there are 18 exceptions which are listed there. Israel, again. Some of these countries are countries where there has been religious radicalization of youth, and that's what would do that sort of thing. Again, a lot of these are Muslim countries, but again, there's no very obvious pattern in there. So 18 countries have the perverse thing that the young say religion is more important to them than the old, and the other 140, the older people are more religious. Let me show you some patterns too. This shows the increasing, these are age groups, 20s, 40s, 60s, 70s, and so on. And I split them up into the World Bank countries of low income countries, low, middle, high income. So the poorest ones are top left, the next one, and then the top one. And you can see the men are the dotted line, women are the solid line. You see that this general effect of women being more religious than men, especially in the middle income countries, and you see religiosity increasing with age. I've done this by religion. This is not the country's religion, this is not the individual's religion, it's the major religion in that country. So you can see the gap between men and women is particularly large in Catholic countries. In Christian countries, hardly at all in Muslim countries, but then everybody's very religious, so there can't really be much gap, and other. Here are some of the health correlates. Did you experience a lot of pain yesterday? And you can see that in the low-income countries, the religious people report less pain. Pain rises with age, as you would expect, but there's a significant advantage for the religious. For the other countries in the world, there's not really very much difference as far as physical pain. This is not emotional pain, this is physical pain. Did you experience a lot of physical pain yesterday? Going back. This is, did you have a lot of energy, plenty of energy to get on with things yesterday? You can see, again, religion's always the solid line, and then not religious is the broken line. Once again, you get an advantage from religion, especially in low and low middle income countries. Period satisfaction with health, there's not much difference in the rich half of the world, but quite a lot of difference in the poor half of the world. So one of the things you might be thinking about there is in much of the poor world, religious organizations play a large part in providing health care to people, not so much in the richer countries of the world. If you ask people whether they're treated with respect, again, a religious advantage, this is, again, largest in low income and low middle income, but it's there throughout the world. Here's smoking, which we heard about already. You're much less likely to smoke if religion is important in your life. And that, again, is true throughout the world, though the biggest effects are in low income, low middle, upper middle income countries. So I wanted just to tell you a story before I stop about one of the things that I think is going on here. I wanted to tell you about my dad. My father grew up in a coal mining village in Yorkshire, in England, a very tough coal mining village. It was a place where the social life centered around drinking, carousing, very, very hard work. There was a lot of domestic violence. There was a lot of general violence. This was not a great place to be. My father, like others, minority of others, certainly not the majority of people in those villages, took refuge in Methodism. Methodism was very strongly developed among the working classes. And in such villages, religiosity was very high. The religious behaved better than the non-religious. It brought my father all sorts of benefits, including helping him behave in ways that he thought was appropriate. It helped him value education, which was not heavily valued in the village. And you get a situation in which inside each of these villages, the religious people who are in a minority are much better off in all of these behaviors and in well-being than the non-religious people. But if you look across villages, under my story at least, the villages that have the most religion are the worst villages. And that's because the religion is a response to the unpleasant conditions. And I think if you think about it that way, it resolves a lot of the stories. I think of Psalm 46, God is our refuge and strength and a very present help in trouble. So if people around the world respond to the difficulties of life, to living in a place that's difficult, dangerous, and uncivilized, where the state is weak, where the state monopoly on violence is weakly enforced or has never really been exerted, where there's little law and order, there are pathological habits and behaviors, women are treated pretty badly, and life chances are poor, then church provides a sanctuary in that place for some people. And so that helps improve the lives of the people in these bad places because religion is genuinely helpful, or that's my story. And it is a refuge for these people and helps make them better off. But if you look across countries or you look across states in the United States, because the religion is a response to the evil that's outside, the worst places have the highest religiosity, even though within those places, the religious people are doing better and behaving better and all the things we've seen. And that seems to be what we see in the data. And this, of course, is just a conjecture at this point, but I think any conjecture has to explain this paradox between the states on the one hand, the countries on the one hand, the states and countries on the one hand, and the experience of individual people within these countries on the other hand. And this is my estimate of doing that. Thank you very much.
The study was just published in 2011 in Journal of Personality and Social Psychology, and a lot of kind of interesting findings. Well, one, I don't know if it's been said yet, but about 2/3 of the people, based on our polling data around the world, say religion's an important part of their life. So when you just ask people, they say that it's important for the most part. But that number varies considerably. The percentage varies considerably around the world, from 99% in some countries all the way down to 16% in others. In the U.S., across states, it varies from 88% to 44%. The highest, Mississippi, Alabama, Louisiana, South Carolina, Tennessee, and the lowest to New Hampshire and Vermont, in terms of percent saying that religion's an important part of their life. So quite a bit of variance across different parts of the U.S. and around different parts of the world. And societies are fairly homogeneous in that respect. A lot of variance within societies, but there's still quite a bit of homogeneity in different pockets. Religion, as Angus mentioned and found in his research, religion is seen as more important for people in worse situations, people with lower education, income, lower life expectancy, safety, and basic needs. So those where those basic needs are low, religion's more likely to be higher. That's probably something that's pretty conclusive from all the research that I've looked at that's been done. Religiosity correlates with well-being. Of course, it varies though in different parts of the world, but both life evaluations and daily mood, when you control for those, these factors I list up here, when you control for those, then there's still a positive correlation left over at the individual level, but it shrinks quite a bit. And it varies considerably in different parts of the world across different countries. The effects of major world religions are more similar than different in terms of the effect of feeling that religion is an important part of your life and life evaluation and daily experiences. Those are much more similar than different across the major religions in the world. And religiosity correlates more highly with well-being for individuals living in more religious countries. I think this may depend on how you do this research. This is based on standardized effects, but in general, those correlations are higher in countries that have higher religiosity to begin with. And the other thing that seems to stick out, not only in the panel research I've had a chance to look at in some of the U.S. data and the world data, is that religiosity is more highly related to positive feelings than the absence of negative feelings. And in some cases, negative feelings are higher in some parts of the world. So a relationship on the affect side more toward an increase in positive feelings or and emotions. Why does religiosity often relate to well-being? Well, I think you've seen a number of mediators that have been listed here as possibilities. There's evidence that social support and opportunities for social contact have an impact. That is, that it explains a good chunk of the relationship between religiosity and well-being. Whether people are treated with respect, this is found in the Deaton study, treated with respect, whether people share values or beliefs, whether people sense purpose or meaning or life interest. It's another possible mediator that comes out in the research that's been done so far. Healthy behaviors, as Frank mentioned, and Angus, in terms of smoking in particular, pretty universal across the world. And then potentially social norms. If that finding holds up about more religious parts of the world, if there's a stronger relationship there, that might speak to social norms and the influence that social norms have on whether religion has an impact or not. In our well-being research around the world, one of the things we found as we went out and studied is that we found we're really trying to understand, are there some areas that individual people can act on and that organizations can act on to influence well-being that are generalizable, that are pretty consistent in their relationship to well-being across different parts of the world. We know the effect of religion varies a bit, but we found that there are 5. There's probably more than this, but these 5 explain a good chunk of what we found, explains important variants that people can act on and control in regard to well-being, both in terms of daily experiences, life evaluations, also in terms of some organizational outcomes, such as whether people stay or leave organizations, and productivity, some productivity outcomes we've had a chance to look at, whether customers feel more satisfied in businesses that we study. One of the more basic ones, we call it career well-being, and it's important as I go through this panel research here in a second that you understand what we mean by career well-being. This isn't just about in your job, it's about how you occupy your time on a daily basis, or do you like what you do. So it's a bit broader than what you might have heard of in terms of employee engagement or job satisfaction. This applies to students, it applies to people who are retired. It's, do you like what you do on a daily basis, and do you find interest in what you're doing each day? That's an important foundational element we found. Social well-being is about the relationships and the love you have in your life. So another one that I'd call a basic, it's about your network of friends. It's about having a mentor who encourages your development. It's about your closest relationships and your planned activities. Financial well-being is one that relates to managing your economic life to reduce stress and increase security. It's about short-term money management. It's about long-term security. It's also about getting your basic needs met, food and shelter kinds of things. Physical well-being, not just about disease burden, but it's about how much energy you bring with you on a daily basis. You have good health, but you also have enough energy to get things done daily that you want to get done. And community well-being, it really kind of a differentiator between a good life and a great life for most of the people we've studied is at a basic level about living in a safe place, but at a higher level it's about engagement and involvement in the area where you live. Now, you look at this list, and of course, given the topic of our discussion here today, you ask the obvious question, where does religion fit into this list? What about spirituality? How does that fit? And I get this question quite often. Now, these 5, you've got to kind of keep in mind here that these 5 were developed based on the fact that they generalize across different parts of the world in terms of their relationship to these well-being outcomes. We did study, though, in this panel study that I've been referring to, how these operate potentially as mediators in the relationship between well-being and relationship between religiosity and well-being on our longitudinal panel in the U.S. This panel I've been referring to, it's drawn from our random digit dial nightly studies, although it's not fully representative because we don't have complete compliance in terms of the people that actually participate, and we also have some fallout, some attrition rate. But it's not a high attrition rate, but this panel is useful in a different kind of way in that we can track the same people over time and look at changes not only in well-being, but changes in religiosity and changes in those elements that I just listed. We've got 4 waves across 2 years in this panel, about 6 months apart. Our sample size is about 12,500 with 4 waves, 13,000, almost 14,000 with 3 waves of data. We're going to continue to track this. We have a small amount of change in religiosity right now, and so we don't have huge change data to study from that perspective, but we were able to look at how, for instance, time 1 well-being, or pardon me, time 1 religiosity related to time 2 mediators, relating then to time 3 well-being and changes in well-being over time. So this is an example. This is with a 1-year lag, and this is only controlling for demographics. If religion's an important part of someone's life, this is the ladder of life that everybody's been referring to. There is a difference between those who say religion's important and not important. Again, this is U.S. data, so we would expect that. When we control for those demographics, all those demographics and those 5 elements that I listed, career, social, financial, physical, and community well-being, that drops the relationship quite a bit. Now, this doesn't say that religion's unimportant. It just says there's some things that explain this difference. So when we control for all those things, it drops. They don't explain all of it. There's still some left over that could be due to other factors, could be due to those church friends that you don't pick up for, maybe not completely in the social well-being component. But it explains a pretty good percent. In fact, the mediation is about 70, it's a little bit over 70% mediation here just from those 5 elements. Positive affect, and this here we're defining it as whether people feel yesterday they're calm, happy, and had a lot of enjoyment and high interest. This is with a 1-year lag. Again, controlling for demos, there's a significant difference. That difference goes away in terms of positive affect when you control for those 5 elements, meaning that there are potential, based on this design, there are potential mediators that explain why religion might be related to well-being. This is kind of what it looks like when you put it into a path model, but you see over here on your left, we looked at both religiosity and spirituality. We had a spirituality component as well. These 5 elements are each measured by 10 items each. So they're pretty reliable elements. And then we looked at how they then predicted these outcomes, life evaluation, daily experiences, and affect. We're at 100% mediation here, 73 to 83% here, depending on whether we asked about religion or spirituality. When we asked about spirituality, it went up to 83%. So what does this mean? It means that it's likely that religiosity or spirituality, when it influences life evaluations and daily experiences, it influences them through these other kinds of variables that are going on in our lives, these other factors that are going on in our lives. Probably maybe a sign of a pretty authentic kind of religion or spirituality that is embedded in all aspects of someone's life. Now, we did test another model where we put this circle over here, and that showed no mediation. So right now, at least based on this time series data we have right now, it looks like it's clearly religion and spirituality over here versus, in between these well-being dimensions and them influencing religion or spirituality. So that's some of what we've done up to this point. We're going to put together a paper outlining our methodology and everything and continue to track this. One of the weaknesses of our current designs that are out there now on this topic, I think, is just the limited longitudinal nature of them. But I want to turn to, finally, before I close here and we get into more kind of in-depth discussion, I was listening several years ago to George Valiant, who's a professor, and he was up here talking, and he made a statement that kind of stuck with me. He said, there's a reason religions have lasted longer than businesses. Think about that. But then I take a step back and I think about what I do for most of my job is study organizations. So we go into organizations, study high-functioning organizations and what really drives performance in those organizations. When I look at those high-functioning organizations, there are a lot of parallels that you see between what you find in high-functioning individuals when religion is really working to their advantage. And here's some of them, I think. One is a common mission or purpose. High-functioning organizations, these are the ones that really produce high levels of performance consistently over time. They have over 70% of people who say that the mission or purpose of my organization makes me feel my job is important. So they're strongly agreeing with that. So there's really positive things going on in these high-functioning organizations. I think overlap a lot with what you'll find in religious organizations. They have strong social connections. A high percentage of people say they have a best friend at work. Not just a friend at work, but they have a best friend at work. They have people who they say care about them and their development on a regular basis. They say they have chances to learn and grow. These types of perceptions, they vary considerably across different types of organizations, even across religious organizations, even across church-sponsored hospitals when we study them versus non-church-sponsored hospitals. wide variation within each of those groups. There's something that happens at kind of a local level that probably influences how these kinds of things are applied on a daily basis that we've seen. One of the keys is really the quality of the management that's in place in these organizations. So I'll close with that and looking forward to some more discussion. Thank you.